Good afternoon, and welcome to today's significant program. This is part of New Jersey's official Stillbirth Awareness Campaign, Townhall. I'm Marie Carl Vilsius-Talty, and I'm so honored to serve as the President and CEO of the Partnership for Maternal and Child Health of Northern New Jersey. We extend our gratitude to the collaborative efforts of Central Jersey Family Health Consortium, sorry about that, South Jersey Perinatal Cooperative, and the invaluable contributions of Debbie Hain, Vijay Vigera in developing this impactful campaign. So whether you're personally faced by the challenge of stillbirth, whether you're a dedicated professional caring for families who've gone through stillbirth, or whether you've never heard of this topic at all, we are generally pleased to have you with us today. This campaign is titled Stillbirth Can Happen to Any Pregnancy, and it aims to shed light to this really important issue. In today's program, you'll be learning insights on the campaign, listening to very personal stories, and discovering ways to actively promote awareness in your community. Thank you so much for joining us, and I pass it over to Sarah Muller-Robbins. Thank you, Sarah.
Thanks, Marie Carl. So yes, I'm Sarah Muller-Robbins. I'm the Director of Clinical Education at the Partnership, and I'm so glad all of you joined us today. I welcome you to have your cell phones available for some interactive portions of today's program. Today, we're also joined by Maurice, Kim, and Taisha, who you'll hear from in a little while. But with this QR code on the screen, it leads to Mentimeter, which we will use to obtain your input throughout the program. You could also go to menti.com and enter the code 8727433. If you don't have a smartphone available, we'll also put the link in the chat. And so as you get your phone set up or put it in the web browser, I'm going to pass this on to my colleague, Taisha James, the Manager of Professional Education at the Partnership, to give some background information on this campaign.
This campaign originated with a grant from the New Jersey Department of Health. The grant was awarded to Central Jersey Family Health Consortium and its 3 collaborating partners: Partnership for Maternal and Child Health of Northern New Jersey, Southern New Jersey Perinatal Cooperative, and Debbie Hain, Vijay Vigera, stillbirth advocate and co-founder of the 2 Degrees Foundation. The goal was to develop a statewide stillbirth awareness campaign so that all may recognize the fact that all pregnancies carry some risk for stillbirth. As Debbie says, the first time someone learns about stillbirth should not be when it happens to them. To honor that sentiment, the title of the campaign is Stillbirth Can Happen to Any Pregnancy. The hope is that this campaign will raise awareness around the problem of stillbirth in New Jersey. We'll educate the community on strategies to prevent stillbirth, and will provide important resources to help guide families who are grieving the loss of stillborn babies and professionals after a stillbirth. Each of the 3 maternal and child health consortia in New Jersey are hosting a town hall, excuse me, are hosting a town hall to share the information, spread the word, and to enact a call to action for all of us to be involved to make this a successful campaign. We thank every one of you who has joined us today for today's virtual town hall hosted by the Partnership for Maternal and Child Health of Northern New Jersey.
Great.
Now I'll
Thanks,
pass it back
Taisha.
to Sarah.
Thank you. So before we continue with today's program, we would like to take a moment to honor those babies who have been lost to stillbirth and the families and loved ones of those babies. Please take a moment to honor all who have been impacted. If you personally have known a baby or family who experienced a stillbirth, you may say the baby's, parents, or loved one's name out loud in your thoughts, or take this opportunity to enter those names in the word cloud in Menti, so we may all read and say their names in silence together. Thank you. We will keep those who have been lost or deeply affected by stillbirth in our hearts and minds as we continue through today's program. This project was guided by parent advisors who shared their personal stories of stillbirth that are highlighted on njstillbirth.org. We would like to welcome the first of our two parent advisors, Kim Stolo, the mother of Abigail Rose, who represented the Northern region in the development and implementation of this project. Kim will discuss the issue of stillbirth and the impact that it has. Thank you so much for joining us, Kim.
In the United States, stillbirth is defined as the death of a baby in utero anytime from the 20th week of pregnancy onward. Stillbirths are devastating and have profound and lifelong effects on families who endure them. Many of these deaths are preventable and are happening in otherwise healthy, low-risk pregnancies. The goal of this campaign is to empower birthing people with the knowledge of the risks and realities of stillbirth so that they are equipped to know the warning signs that something could go wrong and feel confident in contacting their healthcare provider with their concerns. The Centers for Disease Control ranks New Jersey as having the 8th highest stillbirth rate in the United States. The fetal mortality rate was found to be twice as high for Black, non-Hispanic individuals than all other races and ethnicities. Stillbirths occur in 1 in 160 births. Even more shocking is that every pregnancy is at risk for stillbirth. Approximately 700 pregnancies end in stillbirth every year in New Jersey, and over 21,000 in the United States. That is the equivalent to the death of one kindergarten class every day in New Jersey. Every single day. Each one of these numbers represents a life lost and a family forever changed. Unfortunately, the cause of about 1/3 of stillbirths still cannot be determined. Studies show that at least 25% of all stillbirths are preventable. The effects of stillbirth can be extensive for those who experience it and can include mental health issues, stigma and social isolation, relationship strain, financial consequences, and impact on relationships with living and future children. We need to ensure that all expectant parents, healthcare professionals, and the larger community are aware of the stillbirth crisis. And for those who do experience the trauma of stillbirth, we no longer will stay silent, but we will ensure that every family suffering has the support and resources to continue on.
Thank you, Kim. This campaign had its kickoff this past October during Pregnancy and Infant Loss Awareness Month in Central New Jersey. Now we would like to show a video clip of that event.
Today we honor babies who are born sleeping. Today we tell families that they should not stay silent about their grief, and today is the day we acknowledge that stillbirth can happen to anyone.
Before we get started, we ask you to join us for a moment of silence as we remember the babies lost to stillbirth.
Today is our kickoff of New Jersey's first stillbirth awareness campaign. We've been working hard to develop a new website, materials that will be available in multiple languages, and sharing our public service announcements that feature real families from New Jersey.
Prior to this pregnancy, I'd never had any issues in pregnancy.
So today we're just ready to share it with the world, share it with other families in New Jersey, with providers and our hospital systems who are also caring for the families that we serve.
Nationally, 1 out of 169 pregnancies end in stillbirth. And according to the latest available data, about 600 to 700 babies are stillborn annually in New Jersey.
The first time someone hears about stillbirth should not be when it has happened to them. Nothing can ever prepare you for the moment that you learn that your deeply loved baby lay lifeless inside of you.
It felt like my world had shattered into a million pieces. Those years were very dark, and it was filled with unspeakable pain.
Grieving my son is a lifelong journey, but I am determined to channel my love for him into advocacy. I am proud to be a part of New Jersey's Stillbirth Awareness Campaign because this is a resource I wish was available in 2016. It could have helped to save Richard's life.
It took the loss of my son to get that true education that any, birthing parent truly needs to keep their baby healthy.
This is a vital piece of education that I feel has been missing. And I think the biggest problem is it's a difficult conversation to have. But with these resources and the website and personal stories, this is the catapult to making this an important part of prenatal education. Making sure that no woman leaves a provider's office without getting vital information on how to prevent this.
Our work is nowhere near done, but the Stillbirth Awareness Campaign is a step in the right direction.
It's a huge milestone. I mean, when I think about the conversations that I had so many years ago about the need for an awareness campaign, I truly can't believe that we're finally here and that it's happening. And I just hope that through that we are able to give every New Jersey family a fighting chance against stillbirth, because losing babies at this rate should not be the norm. We should do better, and we can with this campaign.
Resources, guidance, and togetherness have a massive impact on our resiliency and our ability to see brighter days ahead. Thank you.
So Kim, I would like to start by speaking with you about your experience. So with this, we're so grateful that all that you contribute in sharing your story of your daughter, Abigail Rose. So I'd like to start by asking, what inspired you to be a part of this campaign? You shared your story of loss, and that's not easy to do. So what inspired you to do so?
So I'm actually a therapist, and when I lost Abigail, even with as many resources as I had, and I understood the systems, and I knew a lot of people, I had no idea what to do with the pain that I was going through. I had no idea what resources were specific to what I had gone through. People were suggesting like regular grief groups, which are not appropriate for the type of loss that I had suffered and other women have suffered, and dads. And so I was really struck by the fact that, I had this traumatic experience. And then there was like this second trauma that went along with it, of just not knowing, people not knowing how to talk to me, people not knowing how to help me, people saying helpful but inappropriate things to me. And it just, I don't believe that things happen for a reason, but I believe that we can take bad things that happen and bring some good out of it. And this was my way of being able to take the situation and educate others and be a voice for other families that have gone through what I went through. So just being able to know what resources are out there and who can be helpful was just really important for me to be a part of that.
Mm-hmm. We're so appreciative that you are. In that video, in the promotional video, you can be heard saying, that we'll be seeing shortly, I wanted people to know that she existed. Can you speak a little bit about how this campaign and website can help keep the names of babies lost to stillbirth still spoken?
Yeah, one of the hardest things that I found after I lost Abigail was the silence, how uncomfortable people were talking to me about this, how quickly people wanted to kind of like usher this away. And when I got pregnant with my son, the idea was like, just focus on that and be happy and don't worry about what happened before. And it was disrespectful to my own process and my own healing and my own experience of loss. But it was also not helpful. And I wanted Abigail's existence to be remembered and to matter. One of the things that I talk about a lot is that, like, I was the only one who knew her in my body. And the way that I can honor her is by saying her name. And after I lost her, it felt very awkward saying her name, or people didn't want to say her name. And so it became like my mission. It became, on Facebook, anytime I could talk about her, I do, because I think it's important not only to honor her memory, but also to give a voice to other women and families that have gone through this or going through this. That we should be able to talk about this. We should have a voice, and we should not have to grieve and heal in silence, because there's so much support out there. And just, like I said, I'm a therapist. I kind of know, the systems. I know what, how to do these things. And I was just so lost. And I think there are some really well-intentioned people. I think there's, clergy and other mental health professionals who think they know the right thing. And they don't. And it's well-intentioned, but this is a part of society, and that we have to do a better job talking about and learning about, so that these families don't feel so alone in what they went through. And so I think that, this campaign is just an amazing way to honor the lives of all of our babies.
Thank you so much, Kim, for sharing your story, sharing Abigail with us, and really impacting the world. And before we turn over and speak with Maurice, I would like to now hear from some other families, some other parents who have experienced stillbirth, as well as to get to see the promotional short video that was made with both Kim and Maurice. So we'll show that now.
Hi, my name is Katie Irish, and I am the mom of a girl who was stillborn on her due date. I had had a picture-perfect pregnancy and had no idea that stillbirth was even still happening. I thought that as soon as I made it out of the first trimester that everything would be fine, and that kind of thing was something that used to happen and didn't happen anymore. So when I lost my baby girl, I felt very alone and didn't know where to turn. And so somewhere like njstillbirth.org would have been a huge help and resource for me.
In terms of like stillbirth awareness that I really want fathers to, know, kind of like really understand, is that one of the things that I just really was taken aback by was just the level of support that most males get, particularly like when you break that down into subsets, like some, for example, like people of color, particularly I'm talking specifically about my own racial identity as a Black male. I felt like there wasn't a lot of support. I felt like there was substantial amount of people telling me to get over it. This is what happens. People reinforcing the fact that this is more of an issue where you're supposed to be supportive of your wife, instead of people saying like, hey, you just basically lost a child, and you should get the grieving time necessary to like address that issue, because it's like you just lost someone, and you grieve. And I think one of the most challenging things that I was dealing with was that I was having the responsibility of walking and chewing gum at the same time. And that was me trying to be supportive of my wife, but then also me trying to figure out things myself. And then I did a very poor job at both. So I wish that, in hindsight, I wish I would have had the support services there that was necessary to kind of like assist me in those efforts while I was grieving. Like, we grieve in the dark, we cry in the dark, and we're hurt from the loss just as our, female counterparts are. So I applaud everyone's efforts in this role. I applaud everything you all are doing in order to, beat the drum about this issue. So whatever I can do in the future, just let me know, and feel free to reach out.
My pregnancy had been going perfectly fine up to that point. I didn't really know how to process it.
You're feeling like your body betrayed you, feeling like your body let down your baby.
It's all your hopes and dreams being ripped from you.
I wanted people to know she existed.
But no matter the outcome, you're not alone.
Stillbirth can happen to any pregnancy. Learn more at njstillbirth.org.
So thank you both so much for being a part of this. And for those who haven't yet seen, on njstillbirth.org, a family who experiences grief can read stories like Kim's and Maurice's so they don't feel so alone. The information on the site has been translated into the 5 most commonly used languages in New Jersey: English, Spanish, Portuguese, Tagalog, and Korean. They can find resources for the numerous organizations in northern New Jersey who support families who experience loss, including Pockets of Light, Griffin Cares, Neshama Comfort, 2 Degrees Foundation, Life After 2 Losses, Courage in Time, and services that are open to all but specifically focus on Black and Brown families, like Nurturing Babies with Elrima Vining and Ivory Tears, and more. These organizations offer support groups and other services for families who experience loss, as well as professionals. The website offers recommendations for children's books to help parents speak with young children about how to understand why the baby is not coming home. And there's information for loved ones who want to support those who experience stillbirth, but need some guidance on what to say and how to be the best support. We know that stillbirth impacts not just the parents of the child lost to stillbirth, but the whole family and the community. So next, I would like to introduce our other parent advocate representing Northern New Jersey for this campaign, Maurice Angelo Gray, mother of Ellison, who was born still. Welcome, Maurice. So Maurice, in the promotional video, at the end, you can be heard saying, "No matter the outcome, you're not alone." How do you see this campaign and website being a resource for families experiencing loss and overcoming that feeling of isolation? Oh, Maurice, let's unmute. I think you're still muted.
Okay, I was. So, when you're a parent of loss, it's so easy to feel so isolated and so alone in those feelings, because no one else knew your baby the way that you do. So for me, I felt like it would have been so wonderful to be able to go to a place where, there are others that I can see. I can see those families. I can see those names. I can see the other babies, and knowing that others have shared this experience, but knowing that they can truly relate to those feelings is, to me, one of the greatest ways to begin a healing journey. We all know that this happens. We all hear that it happens, but there's something different about knowing that there are others out there, that this may happen to, versus like actually being in community with those people. You don't wish this on anyone. No one should ever have to endure this type of pain. But I know that we're all resilient and we can heal from it, but we need to do it in community. We need to do it together.
Yes, sure. So you had other losses prior to Ellison, Carter and Stokely, and then went on to give birth to 2 live babies, Memphis and Emery. Can you speak about how going through your pregnancies was like, and how you would share with others who are pregnant or hoping to be soon about focusing on a healthy pregnancy, both physically and emotionally?
Yes. Man, going through pregnancy after loss, especially after multiple losses, is the hardest and most challenging thing that I've ever been through. I can't even put it into words, but every day, you feel like you're just walking on eggshells. You're constantly waiting for that other shoe to drop. After I lost Ellison, I knew that I needed so much more support, and I needed to find the healthiest ways to navigate, just life in general. So going to support groups and, seeing a therapist were amazing things, but I also knew that every single minute of the day I had to live. I had to live those minutes. I had to be with my thoughts. And I also needed to function, and, things that I thought were really great for me were finding ways to just be more conscious and be okay with sitting in those difficult emotions. And what I found that was so helpful is, finding just healthy practices to take care of my body. Because, when your body is nourished, your mind is nourished, and, you're able to manage things so much better. So of course, like focusing on my nutrition was really, really big. It really helped me kind of minimize my anxiety every day. Getting exercise was so key for me at that time. And just like really kind of paying attention to what was in my environment. Like one thing that I used to do all the time is I don't know if anyone's ever heard of the rule of 5, but it's really kind of like focusing on what's in your environment and what you can see, what you can taste, what you can touch, what you can feel, and kind of understanding like, okay, this is just me being mindful, like these really great mindful practices, and doing breath work and things like that were all ways to just feel grounded, and also to be able to manage when I'm feeling very stressed or when I feel like, like I'm on the verge of maybe having a panic attack. And I believe that those things, these kinds of practices and like taking care of my body, they also helped me to kind of prepare for pregnancy and to continue those same kinds of practices throughout my pregnancy.
Thank you. And so on the njstillbirth.org website, there is a whole section for those who are pregnant to a lot of the things that you mentioned, how to stay healthy, have a healthy pregnancy, and really get to know your baby well. So if something is off, making sure you're reaching out to your healthcare provider. And I know because of all of your experiences with childbirth, Maurice, that you became a doula yourself, a perinatal doula. And so on our website also, we have a lot of information and resources for professionals. So there's a toolkit on njstillbirth.org for professionals who work with families during the perinatal period. These downloadable resources include providing education for expectant families on a healthy pregnancy, how to get to know the baby's movements, ways to communicate with grieving families, supporting families during hospital stay who are experiencing stillbirth, recommendations for evaluation of a stillbirth, and important steps to take when working with families during the postpartum period. I mentioned earlier the many wonderful organizations in Northern New Jersey for bereaved families. The partnership works with Pockets of Light to provide education to hospital staff, and they provide equipment for hospitals so that infants can spend more time with their parents. There is Courage in Time, which provides memory boxes for families in the hospital who experience loss. We've also collaborated with Life After 2 Losses, and also Nurturing Babies helps families work through baby items in the home that can just feel so overwhelming. So these and many organizations, like the ones I mentioned, can be found at njstillbirth.org for families seeking peer support. And so we can hear from a couple of organizations who offer that support, as well as some clinical professionals who can speak about the work and how njstillbirth.org can be a support for them and the families with whom they work.
Hi, I'm Pam Kane, and I'm the co-founder of Griffin Cares Foundation. I'm also a fellow lost mom. The Griffin Cares peer support community is here to help families like ours navigate life after baby loss. We offer free virtual support groups, peer mentors, and helpful resources for birthing parents and partners. As a New Jersey-based organization, We are honored to be able to share the important information available on njstillbirth.org with local families in our community. If you have experienced a stillbirth, I am so deeply sorry for your loss, but please know you are not alone. GriffinCaresFoundation.org and njstillbirth.org are here to help you grieve, heal, and honor your precious baby.
Hi, I'm Reva Judas, the founder and director of Nechama Comfort, a global organization dedicated to helping all family members who experience pregnancy loss, miscarriage, infant loss, stillbirth, SIDS, and any other sudden death of a child up through the age of 1. We are there to give them the guidance and the tools and support. And that is why we are so excited for the creation of the New Jersey Stillbirth Resource. I can't believe this is finally happening. We knew that we did not want people to feel alone the way we did. I started Nechama Comfort because of the birth and the death 12 hours later of our son Pesach. He was born with a severe congenital heart disease, and there was nobody to turn to. There was no support. We were told to go home, go on with our lives, get pregnant, it'll be all better. But we know that's not true. And I am so grateful that there are other organizations and a resource as the New Jersey Stillbirth that will help to deliver, to help deliver the help that's needed to these families, to these individuals, to these extended families, to the community at large, so that everyone can feel comfort.
Hi, my name is Rosa McKenna. I am a labor and delivery nurse, and I'm also a perinatal bereavement specialist at Hackensack Meridian Health, JFK, in Edison, New Jersey. I am delighted to endorse njstillbirth.org for anyone enduring a loss or any healthcare professional like myself caring for grieving families enduring the loss of their precious baby. Stillbirth is a devastating, tragic, and unexpected event that can happen to anyone of any race, age, or socioeconomic status. While we cannot change the outcome of this sad event, at njstillbirth.org, you will find a community willing to provide education, compassionate support, and resources to help you navigate through this most difficult time. At njstillbirth.org, you are not alone. We embrace you. We are willing to walk with you through your healing journey and help you find peace, solace, and hope again. Thank you, njstillbirth.org.
Hi, my name is Lorraine Jondo, and I'm a perinatal mental health coordinator at the Partnership for Maternal and Child Health of Northern New Jersey. My position allows me to work closely with perinatal grieving parents, and njstillbirth.org gives me the essential tools to communicate and support my client in a deep and impactful way. njstillbirth.org has a wealth of resources like bereavement photographers and genetic counseling resources. I am grateful for njstillbirth.org.
Hi, my name is Julie Lazar-Riskakis, and I am the perinatal bereavement specialist at Holy Name Medical Center in Teaneck, New Jersey. The New Jersey Stillbirth.org website is a wonderful addition to our bereavement services here at Holy Name. It's a very comprehensive site for both healthcare professionals and for families needing information, support, and resources. Stillbirth is an important topic that needs to be recognized. On the New Jersey Stillbirth.org website, there is a deep dive for anyone who needs to know more. I particularly like that there is a family advisory board that helped in the creation of this website. Women and families sharing their very own personal stories of loss on video. Whether you're a healthcare professional who's about to enter a room to assist a family who is experiencing a loss, or you are a family who has had a loss and is looking for more information, this website covers it all and has downloadable materials that can be printed and kept handy. The NewJerseyStillbirth.org website is a great resource for our facility, and I will include it in both my staff training modules and in the resource package we give to our families at discharge. Thank you.
My name is Taisha. I am a mother-baby nurse. As a new nurse, just a few weeks off orientation, I was assigned to take care of a mother who had delivered her stillborn baby girl at 38 weeks gestation. Having access to njstillbirth.org's resources for healthcare professionals would have definitely been useful in that situation. Being able to refer to something concrete as a guide on things to say or do and what not to say or do would have better prepared me to comfort and support both parents.
Hello, my name is Daisha Warren, and I am the Program Coordinator for the Prematurity Prevention Initiative at the Partnership for Maternal and Child Health of Northern New Jersey. And NJ Stillbirth is very important to me because in my line of work, I educate birthing individuals who are high risk about the possible risk factors for a preterm birth. And many times I come across families who not only experienced a preterm birth, but also a stillbirth. And NJ Stillbirth gives me the necessary knowledge to better educate the community about ways to find support and how to navigate a preterm birth and also a stillbirth.
Thank you so much for all who contributed to the value of njstillbirth.org, and we're able to speak about it using this during the perinatal period. So I'm going to turn it over to Maurice for our next interactive question on Menti.
So we'd love to hear from you. Who is missing from this conversation? What communities need increased awareness? We've heard from families directly. We've also heard from professionals who worked with the families during the perinatal period, but who else needs to be part of this conversation? Who should be involved? Who needs to learn more about this campaign? And what community needs to learn about the resources available? And yes, I see some of the answers coming through, and these are wonderful. The extended community, grandparents, men, physicians, absolutely, clergy, absolutely, college students. I mean, as we're seeing, this is our entire community. It's all of the networks that we're part of. It's our village. Everyone that touches the lives of, families who have experienced loss. Yes, I see some other ones. Medical students, absolutely. That would be an excellent training to have during medical school, and maybe a requirement, just to hear from families who have had losses. Midwives, yes. High schools, yes. School nurses, absolutely, absolutely. And I just thought of, siblings, especially very young ones, could use, some really, really great, just like learning language around this and understanding what it is when their, baby brother or sister doesn't come home. OB offices, yes, office staff absolutely could use so much training, so much knowledge on this. Non-English individuals, yeah, people from other cultures, other ethnic groups, may have practices around loss of a baby, loss of an unborn baby. But yeah, we could always use so much more collaboration and conversation around this.
Thank you so much for everyone who's contributed to this, and this gives us other ideas of where we need to share this information. And so next we'd like to hear from people that we may not necessarily think of right away when we think of who we need to educate from stillbirth. So let's hear from our next guests.
Hi, I'm Kevin. I'm the Fellas Fatherhood Program Manager under the Partnership for Maternal Child Health of Northern New Jersey, and I'm here to talk to you about njstillbirth.org. This site, www.njstillbirth.org, is a place for everyone, including fathers, to go for information on stillbirth. njstillbirth.org can help grieving families that are seeking support, people who want to support grieving parents, healthcare professionals who want to improve their overall care, or even a community member who's never heard of stillbirth. njstillbirth.org is a resource for everyone.
Hello, my name is Hector Perez, and I'm a program specialist for the Fellows Fatherhood Program at the Partnership for Maternal and Child Health of Northern New Jersey. And my name is Dean McKnight, and I'm also a program specialist for the Fellows Fatherhood Program. We believe here at the Fellows Fatherhood Program that accessing the website NewJerseyStillbirth.org is an essential tool for obtaining information about stillbirths. Did you know that NewJerseyStillbirth.org is committed to helping you and advocating for you and your baby? Almost 1/3 of stillbirths cannot be determined. However, 25% of all stillbirths can be prevented. What can we do to prevent stillbirths? Well, glad you asked. Know your baby's movements and behaviors. If any concerning symptoms arise, we ask that you please contact your healthcare providers. Please stop by NewJerseyStillbirth.org for more information.
We ask that men who become a part of the Fellows Program not only be open for change, but willing to expand. From there, it's up to the fatherhood specialists to provide a safe space for sharing, information, and resources. We are thrilled to collaborate with njstillbirth.org so we can not only raise awareness, but provide initial information to the fathers in the program and their families.
Hi, my name's Arthur, and I'm a college student. I'm about to graduate. I just recently learned about njstillbirth.org, and I'm really glad I did. It's a word I knew. I didn't really know much about it. Now that I do know more about it, I'm really grateful for the resource. Since friends are probably going to start having kids before I know it because it comes up quick, I'm glad to have this resource that I can share with them early on and help them and their future children be happy and healthy.
Hello, my name is Marie Kinsella Stater. I'm the First Lady of Unterful Stature Church located in Jersey City. My husband is Pastor William Statham. He has pastored this church for over 40 years and is very well known in the community. We feel that it's important to know different resources and ways to really direct our congregants as well as our community to resources that they will find helpful and beneficial. Today, we're talking about the New Jersey Stillbirth campaign that's happening in New Jersey, and I think it's really important that we have access to those resources. Personally, I know that whenever the need comes up, I will be using it as well as my husband, and not just to our congregants, but to the community at large. One of the things that I want to end this with is Isaiah 4:6 says, "My people are destroyed for lack of knowledge." This website will definitely support you and the community when and if needed. So I want to thank you for being able to express the sentiments of myself, my husband, around this issue.
So thank you to everyone who contributed to today. I know we're coming toward the end, but I would like to invite our President and CEO, Marie Carl Vilsius-Telti, back on the to join us to speak. So Marie Carl, as someone with experience as an L&D nurse, hospital administrator, and now the President and CEO of the partnership, how do you see njstillbirth.org being used as a resource for patients, for families, professionals, and the community?
Well, Sarah, I could only reiterate the wonderful words that have already been said. Education is key, and stillbirth can happen to any pregnancy. And just because you are a provider, a labor and delivery nurse does not mean that you cannot be educated. And this website is really the key to giving, like someone said before, comprehensive resources to absolutely everyone, regardless of your background, physician, nurse, doula, family, whether you think you know or you need a little more education. This is the gold standard, and everybody should know. It comes in five different languages. It can be translated, and everyone should know about it because education is definitely key. We know the statistics. Now we know that there is a resource that can help bring people together, that can find support groups, so people know that they are not alone when they're going through this. Very, very important. Thank you so much for sharing your stories and bringing us into your experience so we can learn from them. Thank you.
So as we come to the end of this program, I'd like to turn it over to Kim, who will participate in the last interactive for our session.
For everyone on this call, what will you do to raise awareness of stillbirth? There's a downloadable handout all on the call can download by clicking in the upper right corner of your screen. There's a shareable handout for social media. Will you share that with your networks? Will you review the njstillbirth.org and share the information with your colleagues? Will you speak about it with pregnant people and families in your life? Will you share the site with your communities so that the information is well known to all? Will you help to raise awareness with your entire community so they all have the information and resources to decrease the risk of stillbirth so that no one suffers with their grief on their own? So we have some great answers. We have Facebook Live in Spanish, share the website, talk about it, learn more, offer support, add the discussion to birthing classes, word of mouth, show empathy, improve our own education, showing support for families, volunteering, educating during pregnancy, say the baby's name. I can't say that enough. Please say the baby's name. Volunteer, share resources, discuss in preconception, share with friends. All wonderful responses. Thank you.
Thank you. Thank you to everyone who has joined us today. And we extend our sincere appreciation to those who contributed to the content of today's program, with particular appreciation to Kim and Maurice and their sharing of stories of Abigail and Ellison throughout the development of this project and with us today. I extend my thanks to my colleagues who worked so hard on this project throughout the state, including Debbie Hain Vigia, Ann Ruck, Kathy Donaldson, Jenny Sherlock-Loeb, Carl Parker, Celeste Mader, and as well as all those behind the scenes who gave their support. We'd like to thank the support of the New Jersey Department of Health for the grant that allowed this campaign to happen. And lastly, we'd like to thank every one of you who have joined us today and committed to sharing this information with family, friends, colleagues, and the community. Together, we will all work to ensure to reduce the number of families who experience stillbirth and provide the needed support to all those who suffer losses. We continue this work until we know that New Jersey is the safest place to deliver a baby. Thank you.